All right, welcome back to The Explainer. I am so thrilled you're joining me today because we have a truly fantastic medical coding detective case to solve together. If you're laser focused on getting your claims right and really understanding the mechanics behind the rules, well, you are in the exact right place. Today, we're looking at a super specific real-world scenario that honestly trips up a lot of practices, coding for a patient who transfers into your care right in the middle of their pregnancy. We're going to break down the logic, follow the CPT coding guidelines to the absolute letter, and solve this puzzle together using the clues right in front of us.
Section 1. The Mid-Pregnancy Transfer Case. Okay, let's dive into this. So here's our cold open puzzle for the day. Imagine a patient transfers into your physician's care mid-pregnancy. To be specific, they start receiving care at your practice at exactly 28 weeks gestation. They stay with your practice, your provider actually delivers the baby, and then they come back for a routine postpartum visit. Now, I want you to take just a quick second, really think about it. How would you code this encounter? Got a code in mind? Let's see if your instinct actually aligns with the strict guidelines we need to follow.
To solve this, we've got to map out the patient's exact care journey chronologically. Just look at the specific variables we have to account for as coders. Point 1, care begins at week 28. Point 2, during the remainder of that antepartum phase, the patient comes in for exactly 8 visits. Point 3, delivery day arrives, and yep, your provider handles the delivery. And finally, point 4, the patient has one single postpartum visit. This sequence right here, this is our roadmap. We have to make absolutely sure our final coding reflects this exact journey, literally no more and no less.
Section 2. The Global Package Trap.
Now, before we get to the correct answer, we really need to talk about a regulatory hazard that is incredibly easy to fall into if you're not paying close attention. Your first instinct, and honestly the instinct of a lot of seasoned coders, might be to look at the overall outcome and just reach for code 59400, which is the full global package. And hey, it seems logical at first glance, right? I mean, your provider handled the delivery and the postpartum visit, but let's use a little Socratic questioning here. Think about what a full global package really implies. Does that definition actually fit the highly specific patient timeline we just mapped out?
Well, the answer is a definitive no. The crucial point here is this: you absolutely cannot bill 59400. Why? Because the physician did not provide all of the antepartum care. Remember, our patient transferred in at 28 weeks. The CPT guidelines are incredibly strict on this. Billing the full global package when you literally only provided a fraction of the antepartum care, that is a massive compliance trap. We have to follow the guidelines strictly and break this whole thing down.
Section 3. Coding antepartum care correctly. Let's move to the next part and see how this all builds together. Okay, so since the global package is totally out the window, we have to rebuild our claim piece by piece, based strictly on what was actually done. And what's really interesting here is the number 8. It's not just a random figure, right? It represents the exact number of antepartum visits the patient received after transferring to your practice at 28 weeks. This specific number is the absolute key to unlocking the very first part of our guideline compliance solution.
Based directly on those 8 specific visits, the CPT guidelines point us right to our first code. For the antepartum care portion of this patient's journey, you must report 59426. This code accurately captures the specific volume of antepartum visits provided by your practice, and it ensures you are only billing for the services actually rendered after that 20-week transfer. Make sense?
Section 4. Delivery and postpartum coding.
All right, so with the antepartum care correctly coded, we now need to shift our focus to the final 2 events in our patient's timeline to completely finish this puzzle. Here is the second half of our solution. For the delivery itself, plus the subsequent postpartum visit, our source material clearly tells us to report 59410. This specific code neatly bundles the delivery performed by your provider with the postpartum care that followed. It perfectly matches those final 2 data points on our patient's timeline, and crucially, it does it without overstepping into that dangerous global package territory.
Section 5. The Final Claim Summary.
We have officially cracked the case. Now, it's time to take these individual pieces we've deduced and finally assemble them into our correct, fully compliant claim. And this brilliantly illustrates how breaking a complex scenario down step by step gives us the exact codes required for strict CPT compliance. Step 1, we report 59426 to cover those 8 antepartum visits. Step 2, we report 59410 to cover the delivery and the postpartum care. By separating these out, we are accurately and honestly reflecting the provider's exact work.
Let's quickly summarize the rationale by looking at this side-by-side comparison. On the left side, we've got the incorrect method, using 59400, that full global code. Again, this is wrong because it falsely claims your practice provided all the antepartum care from day one, which we didn't. But over on the right side, we see the correct method, combining 59426 and 59410. This two-code solution perfectly captures the reality of a mid-pregnancy transfer. It ensures your coding is accurate, it's ethical, and it's completely aligned with every single CPT guideline.
As we wrap up today's explainer, I really want to leave you with a provocative thought to keep those coding gears turning. In our scenario today, the patient had exactly 8 antepartum visits. But what if they had transferred in later and only had 3 visits? Or, on the flip side, what if they were high risk and needed 15? How would a change in that one tiny variable, just the number of antepartum visits, alter this entire claim? It is a great reminder that in medical coding, the smallest details literally dictate the rules. Keep studying those CPT guidelines, keep asking great questions, and I will see you in the next explainer.